Every pregnancy is at risk of complications. 340,000 women die in childbirth or shortly after every year. We know that the vast majority of these deaths can be prevented, and for every woman who dies, another 20 suffer debilitating complications. The most devastating is obstetric fistula. Imagine a woman in labour for several days, struggling to give birth. She needs a caesarean section but has no access to obstetric care. The baby's head exerts prolonged pressure against the bladder and rectum walls. In most cases, the baby will be stillborn. The woman will develop a hole or fistula, resulting in leakage of urine and/or feces.
WAHA በለሳ ነው በሽታዬ ፈሳሽ ሰገራ በመውለድ በታመም በአራት ቀን ተላገላገል።
According to the World Health Organization, around 2 million women are suffering from fistula, while an additional 100,000 new cases occur every year. The impact is life-shattering.
This is a terrible quality of life problem. It is almost like social cancer. You are shunned and you're an outcast. Nobody wants you, your friends, your family. So this is something that goes to the core of the community, okay? Because this can be your mother, your sister, you know, your daughter.
Treatment does exist and can restore a full, normal life of dignity to most women. Specialized surgery has a success rate of up to 90%. However, access to treatment must be improved. WAHA International works in partnership with university teaching hospitals to integrate fistula repair into the training of gynecology and urology postgraduate students, so that a greater number of professionals will be able to offer this service in the future.
You really need to build sustainability when you're trying to help any country build up their patient care. And it really makes no sense to always only have doctors come in. You must build from the inside out.
The strategy WAHA following is that to integrate the obstetric fistula care services and training services to existing services of these public institutions, so that more and more professionals such as obstetricians, gynecologists and urologists are trained.
But what they will need obviously are funding for equipment. You know, it is not a surgery where you require very fancy instrumentation or fancy testing. It is very, very doable for a small amount of money.
But ultimately, prevention is the key to eliminating fistula. Pregnant women must have timely access to emergency obstetric care when they encounter a complication during labour. WAHA International has introduced a system of community mobile phones and ambulance motorbikes in order to reduce the delay in receiving healthcare in rural, remote areas.
I think you can do so much good if we can all band together and really target this problem. You know, not just fixing the complication, but as WAHA International, one of the goals is to prevent it.
Obstetric fistula was eliminated in resource-rich countries more than 100 years ago, but women in Africa and Asia are still suffering from this entirely preventable and treatable condition. Change is possible. Let's work together to make it happen.
I'll be happy to have my normal life as it has been there before. I'll be very happy. I'm very sure even my family will be happy, more especially my husband, because he's been going through a hard time.
Since its creation, WAHA International has worked in over 17 countries in Africa and Asia. WAHA implements innovative strategies to improve women's access to skilled help during delivery and postpartum care. Programs are developed in partnership with university teaching hospitals, midwife associations, obstetricians and gynecologists, surgeons, community groups and policymakers from the countries where the projects are implemented.